The 5 adductors are located along the medial thigh between the hamstrings and quadriceps femoris muscles. Their proximal tendons attach at specific locations along the base of the pelvis. When the thigh is viewed anteriorly, the muscle bellies of the adductors lie in 3 layers. The pectineus and adductor longus are most anterior. Then, behind them, is the adductor brevis, and most posterior is the adductor magnus. The 5th adductor, gracilis, lies superficially on the medial thigh. It is the only adductor that crosses the knee. Although their individual bellies may be challenging to isolate, as a group, the adductors are easy to locate.
So before we access the adductors, let me answer a question that might be on your mind. How do we locate structures here on the medial thigh without contacting the genitals? It's a fair and appropriate question. Well, in short, all of these tendons and muscles and bony landmarks can be accessed without contacting the genitals. If you follow the instructions given, both the comfort of you and your partner will be maintained. And as a suggestion, I encourage you to explore and locate these structures on yourself first. It just lends confidence. Now, with all that said, it should be obvious that palpation on a male is complicated by the location of the penis and testicles. But there's a couple things you can do. First of all, I can just put my thigh on the table like so and flex and laterally rotate my partner's thigh, bringing all of this tissue away from the groin. The other thing I can do is I can always ask my partner to shift his genitals to the side. For example, Mort, what I'd like to do is access the adductors here on the inner thigh that attach at the base of the pelvis. Would you be willing to just shift your genitals to the side, just getting them out of the way? Sure. That'd be great. So he agrees, he does so, and now I know that both myself and my partner will be comfortable. So let's begin by seeing the adductors engaged. I'm going to again just flex and laterally rotate my partner's thigh like so. And I'm just going to put my hand on his medial knee and ask him to just try to adduct his thigh. Great. And there we can really see a nice example of the adductors as they fit right there on the medial thigh. Here we've got the line of the sartorius forming the anterior edge of where the adductors are. And back here posteriorly we have the biceps femoris. And right in this V, sort of right there, we're going to have the adductors. And if I set my hand right there, wow, this tissue is really engaged as he adducts. Great. And relax. So before we isolate specific muscle bellies of the adductor group, I want to locate the bony landmarks of where all these muscles attach at the base of the pelvis. And the first landmark I'm going to find is the pubic crest. Now you might remember that from the rectus abdominis. That was the one that was about 6 or 8 inches below the navel. So I'm going to ask my partner if you want to find your pubic crest for me. There you go. And may I? Okay. And so there's his pubic crest, very prominent just above that pubic hairline. And from there, I'm going to just walk my fingers laterally out in the direction of the ASIS, that prominent bony landmark right there, and deep to this inguinal ligament that passes between the ASIS and the pubic crest is going to be the superior ramus of the pubis. That's going to be the attachment for the pectineus muscle. Then, if we walk our fingers back, I'll follow this bony ridge as it curls all the way around the medial side of the thigh to the ischial tuberosity. And there we can just feel that bony ridge. And I can feel tendons from the adductors sort of penetrating and attaching right there. And we can follow all the way back around to that ischial tuberosity. Now, it's interesting. The ischial tuberosity is that bony landmark at the base of the buttocks. And what's curious is there is a continual bony line from the pubic crest all the way around to the ischial tuberosity. And that's going to serve as attachment sites for the adductors. Good. So now let's see if we can isolate a few specific bellies. I'm going to ask my partner to just adduct again. There you go. And I'm just going to set my hand there. And I'm going to find a prominent tendon, sort of right here at the apex of the adductors. Good. Keep adducting a little bit. And right there is a prominent tendon that goes right to the base of the pelvis. Good. And relax. Now that prominent tendon will either be the gracilis, the adductor longus, or both. And it's a great benchmark to get a handle on the muscles that are anterior to that tendon and posterior. I'll show you. So I'll find that tendon and follow it distally. And as I do so, there is about a 2-finger wide muscle belly that runs superficially down the medial thigh. And that must be the gracilis, because the adductor longus is going to head this way. And so I've got the gracilis nice and superficial right here, running all the way down and attaching here at that pes anserinus region. And then if I go back to that tendon and fall a little bit anterior, there I can feel a bit of the adductor longus. Go ahead and adduct just a little bit. Great. And there I can feel a real solid contraction as the adductor longus seems to penetrate underneath the sartorius and disappear into the thigh. So we've got gracilis, adductor longus, and then if I continue up this way into that sort of corner of the thigh, that's where I'm going to find the pectineus. And this time, go ahead and flex a little bit. Flex your knee toward your, there you go. Great. And there's a little contraction of the pectineus underneath my fingers. Great. And relax. Now, one thing to note about the pectineus is running superficial to it will be the femoral artery, nerve, and vein. So if your partner complains of any tingling or you feel a strong pulse under your fingers, go ahead and shift your fingers appropriately. Okay, so we've got pectineus, adductor longus, and gracilis. Where's the adductor brevis? It's deep right here to the adductor longus and pectineus. And then finally, you're probably wondering, where's the big one, adductor magnus? Well, adductor magnus is going to be deep to all of these right in here. And for that, we're going to turn my partner sideline. So my partner's sideline, and I've got his top leg bolstered. And I'm just going to begin by asking him to just adduct his thigh. So he's going to try to raise his thigh up a little bit. And there we can see all of that tissue of the adductors that we saw from a supine position. And there's the edge of the adductors, here being the hamstrings. And there again is that sartorius muscle and the quadriceps. So all in that V, that's the adductors. Good. Go ahead and relax. So the adductor magnus is going to be located more on the posterior side of where that prominent tendon was. So go ahead and adduct again. And I can follow these up. And there's that prominent tendon right there of the gracilis and the adductor longus. So go ahead and relax. And I know that all of this tissue here, right up to that ischial tuberosity right there, is going to be the adductor magnus. A very dense, thick muscle and filling in that space. And the adductor magnus is going to come all the way down and attach at the adductor tubercle here at the bottom of the femur. And if I ask my partner to just adduct your thigh again, I can feel there's that adductor magnus becoming more tendinous and very thin band. And sure enough, it attaches right there at that adductor tubercle, right on the side of the leg. It's that place your brother used to pinch when you were a kid, make you squeal. Well, that's the adductor magnus tendon attaching right there. Great. Go ahead and relax. So to lengthen the adductors, I can simply abduct the thigh like so. And to shorten them, I can return the leg back to neutral, adducting the thigh. One last note about the adductors. I encourage you to explore and palpate them on as many people as possible. Because they're on the inner thigh, you may be a little hesitant to explore there, but it's all the more reason to do so. And on behalf of all your future clients who may have a groin pull or an imbalanced pelvis, being confident, comfortable, and experienced with the adductors is a really good thing.